Hello, I'm Jacqueline Jackson, Chiropodist at the Leamington and Tilbury Family Health Teams. In this video, I'm going to discuss plantar warts, signs and symptoms, treatment, and prevention. What are plantar warts? Warts are one of several soft tissue conditions of the foot that can be quite painful. They are caused by a virus, which generally invades the skin through small or invisible cuts and abrasions. They can appear anywhere on the skin, but technically only those on the sole of the foot are called plantar warts. Children, especially teenagers, tend to be more susceptible to warts than adults. Some people seem to be immune to warts. How are warts identified? Most warts are harmless, even though they may be painful. They are often mistaken for corns or calluses, which are layers of dead skin that build up to protect an area which is continually being irritated. The wart, however, is a viral infection. It is also possible for a variety of more serious lesions to appear on the foot, including malignant lesions such as carcinomas and melanomas. Although rare, these conditions can sometimes be misidentified as a wart. It is wise to consult a chiropodist or doctor when any suspicious growth or eruption is detected on the skin of the foot in order to ensure a correct diagnosis. Plantar warts tend to be hard and flat, with a rough surface and well-defined boundaries. Warts are generally raised and fleshier when they are on the top of the foot or on the toes. Plantar warts are often gray or brown, but the color may vary, with a center that appears as one or more pinpoints of black. It is important to note that warts can be very resistant to treatment and have a tendency to reoccur. What is the source of the virus? The plantar wart is often contracted by walking barefoot on dirty surfaces or littered ground where the virus is lurking. The causative virus, known as the human papillomavirus, thrives in warm, moist environments, making infection a common occurrence in communal bathing facilities. If left untreated, warts can grow to 1 inch or more in circumference and can spread into clusters of several warts. Those are often called mosaic warts. Like any other infectious lesion, plantar warts are spread by touching, scratching, or even by contact with skin shed from another wart. The wart may also bleed, which is another route for spreading. Occasionally, warts can spontaneously disappear after a short time, and just as frequently, they can reoccur in this same location. When plantar warts develop on the weight-bearing areas of the foot, like the ball of the foot or the heel, they can be the source of a sharp burning pain. Pain occurs when weight is brought to bear directly on the wart, although pressure on the side of a wart can create equally intense pain. What are the signs and symptoms of a wart? The signs and symptoms of a plantar wart may include thickened skin. Often a plantar wart resembles a callus because it is rough, thick tissue. Pain. A plantar wart usually hurts during walking and standing, and there is pain when the sides of the wart are squeezed. You may see tiny black dots. These often appear on the surface of the wart. The dots are actually dried blood contained in infected capillaries, which are tiny blood vessels that feed the wart. And the plantar warts grow deep into the skin. Usually this growth occurs slowly. The wart starts off small and then gets larger over the time. You may liken it to an iceberg where you only see the surface of the wart on top, but much of the wart is actually invisible to the eye. So, with regards to treatment, you may want to start with an over-the-counter preparation that contains acids or chemicals that destroy the skin cells. However, self-treatment with such medications should be avoided by people with diabetes, and those with cardiovascular or circulatory disorders. And you never use them in the presence of an active infection. If the wart does not respond to treatment, seek professional care. To diagnose a plantar wart, the chiropodist will examine the patient's foot and look for signs and symptoms of a wart. Although plantar warts may eventually clear up on their own, most patients desire faster relief. The goal of the treatment is to completely remove the wart. The chiropodist may use topical or oral treatments, cryotherapy, which is freezing, or needling. Regardless of the treatment approach undertaken, it is important that the patient follow the chiropodist's instructions, including all home care and medication that has been prescribed, as well as follow-up visits. It's important to know that warts may return, requiring further treatment. If there is no response to treatment, further diagnostic evaluation may be necessary. And although there are many folk remedies for warts, patients should be aware that many of these are unproven and they may be dangerous. Finally, here are some tips for prevention of warts. Avoid walking barefoot, except if you're on a sandy beach. Avoid using communal showers. If you must, wear swim shoes or flip-flops. Change your shoes and socks daily. Never share shoes. Keep your feet clean and dry. Check children's feet periodically. If you have a wart, or you know someone that does have a wart, avoid direct contact with the wart, either from that person or from other parts of the body. Do not ignore growths on your skin or changes in your skin. If you have a wart, keep it covered and use a waterproof bandage if you are swimming. Use your own bath mat and towel, and use Dettol or bleach to disinfect shoes, socks, and shower floors. If you think you have a plantar wart, or you have a wart that you know that is not resolving with home care, please make sure to contact your doctor or your chiropodist. Thanks for watching.